Meanwhile, Gauteng Health MEC Dr. Bandile Masuku says health officials are putting further measures in place to assist those infected with the coronavirus, with cases expected to rapidly rise across the province. This after the Health Minister Dr. Mkhize said that Gauteng is soon expected to overtake the Western Cape's coronavirus numbers as the province with the most cases. To discuss as to how bad it will get for all the people in Gauteng, we are now joined via Skype by Professor Alex van der Heever. He's the chair in the field of Social Security Systems Administration and Management Studies at the University of Witwatersrand School of Governance. Good afternoon to you, Prof. Thank you so much for joining us here on the SABC News channel.
Good afternoon.
Now, Gauteng continues to report an increase in COVID-19 cases. Is this expected more so around this time? We had the MEC of Health here in Gauteng last week on the show, and he reflected on the backlog of the results on the tests that have been conducted.
Yeah, I'm not sure that this is to be expected. And I think that language is problematic. The epidemic itself and its trajectory is largely affected by the prevention strategies that are implemented. And if the prevention strategies don't work, then the epidemic takes off. So, for instance, in the Western Cape, we've seen a turning in the epidemic. The trajectory is now downward at the moment, and one will have to see how long that lasts, and if anything turns it back up again. But that peak that we're seeing in the Western Cape is not due to a natural peak. It's not due to the fact that it's run out of people to infect. There's still an enormous number of people who are susceptible to infection in the Western Cape, and it's entirely due to the prevention strategy. So in Gauteng, we're seeing a steeper increase in new infections, new cases, relative to what we saw in the Western Cape. And this largely looks as though the prevention strategy in Gauteng is not working, rather than an argument that this is what was expected.
And so if you say that the prevention strategy here in Gauteng is not working, so how bad will the situation get? And do you get the sense that the province may be ready for the surge in this COVID-19 cases?
So firstly, there's a question as to whether or not the province is going to react to this surge, the spike in new cases, by focusing very heavily on the hotspots in order to try and prevent the epidemic from taking off in those areas. So that's essentially the approach being used in the Western Cape, and hopefully that approach is being used elsewhere as well. And what it means is that when you find that there are essentially an example of super event occur in particular areas, that's where you get the hotspots, that you really heavily focus on those areas with testing, tracing, but also screening and quarantining people, going and sort of intensively focusing on trying to separate the infected from the uninfected in those areas. If you don't do that, it's almost impossible, once you lose control of the epidemic, to have enough services in place to cope with the scale of the epidemic that may result. It could be a very, very bad epidemic, or it could be one where we curtail it. So things were getting very bad in the Western Cape. They've kind of turned a corner, but they will turn right back again if they take their foot off the pedal. So in Gauteng, it looks as though what we're seeing is they've taken the foot off the pedal. But I'm not sure that we will actually have enough services to cope if this trajectory continues for very much longer. But it looks very, very worrying.
I wanted to ask you about the health system. Will it be able to cope with the surge in the number of COVID-19 cases in Gauteng? We've seen a number of measures put in place. There are field hospital. There's just one across the road where we are in Nesrec here. And as I said, we had this conversation with the MEC for Health in Gauteng, Dr. Masuku, who was telling us that the province is ready. They are aware that things are expected to get a bit ugly, but they are aware they've got plans in place.
So firstly, the field hospital beds are not necessarily fully equipped hospital beds. They at best they could be classified as beds for quarantining people with very mild illness. The beds that are required for the surge are going to be critical care beds, which Gauteng does have the largest number of available critical care beds. So provided it is able to access both the public and private sector beds. But it's important to note that the number of medical scheme members that are COVID ill has increased quite dramatically in the last 3 weeks as well. And so there are a lot of hospital beds being used by private patients. So these beds are also being constrained now, just naturally. So the public sector beds are also quite limited in Gauteng. They will reach their limit quite quickly. They will have to use private sector beds. For that, they will have to have an agreement and a framework for sharing beds in place. There have been negotiations to date. It looks like they will be able to action those arrangements, which will make both public and private sector beds available to both the public sector and private sector patients. But that will take us only so far. I think that we have the risk that we could have a blowout here and a sort of outbreak that could exceed the capacity of both our public and private sectors. So as I pointed out, the beds at Nazareth are not adequate. They're not equivalent to the beds that were put up in the Western Cape, which had oxygen supplied to them. They could actually treat seriously ill patients in those beds. But even there, the problem was, did they have the nurses, did they have the staff for them? And that is very unclear. So I think that we will have to wait and see whether or not we will be able to cope. But it would be really important not to get there, not to require that we have to use these beds, because really when we need critical care beds, we've got seriously ill people and we will have high mortality.
So, Prof, there are also concerns that South Africa might have opened too soon. Other grades are also returning to school from the 6th of July, as we know. Do you think that we sort of jumped the gun by opening up the economy and going into level 3? Was it too soon to do that?
I don't think it was too soon to open the economy. I don't really think that we had a choice in that in South Africa. We are not in the same position as the United Kingdom and the United States. They can withstand much longer periods of lockdown and still bounce back. In South Africa, we could face permanent damage to our long-term damage to our economy. Certainly as we lose markets and we lose investment in South Africa. The other issue is that government depends on the revenue that it gets to fight the epidemic from businesses that stay open. So there are serious limits to what we could do from the economic perspective. But the question is really whether or not we should have opened up things that are not essential to going. So we are still, in many cases, the flu epidemics are driven by schools. And I do think that we have to look very, very carefully at the extent to which school openings are resulting in a resurgence of the epidemic. They will have to be watched incredibly closely. But other areas, such as funerals, those kinds of gatherings that are not necessary at this point, should really have been contained to a lot lower level. The other issue is that it's unclear that a lot of the guidance that has been given for people to protect themselves in communal spaces has really given people the information they need to protect themselves. So, for instance, things like adequate ventilation are hugely important issues, but it's never taken as seriously as washing hands or cleaning surfaces. Ventilation is probably poor ventilation is where you're getting infected. It's in the air, in an enclosed space. And so the discussions around taxis and how people are protected in buses are really critical, but they don't seem to have reached a point where the prevention strategies are really equal to the task. I'm afraid people have to get used to the fact that restaurants have to be open to the open air if you can't sit in enclosed spaces, and buses have to have their windows down. Taxis have to have their windows down. So ventilation is really important.
Prof, I wish we had more time on this, but time constraints, we have to leave it at this. Thank you so much for coming through. That's Professor Alex van der Heever. He is the chair in the field of Social Security Systems Administration and Management Studies at the University of the Witwatersrand School of Governance, talking to us about the situation specifically here in Gauteng. We had the Gauteng Health MEC, Dr. Bandile Masuku, saying that health officials are putting further measures in place to assist those that are infected with coronavirus. The minister saying that Gauteng is expected to overtake the Western Cape in terms of the high numbers of positive cases of coronavirus. So, Prof, they're questioning the prevention strategies that Gauteng has employed. This, of course, is a developing story that we're keeping a very close eye on. But let's move along.